Blessings one and all. It is with great honor I stand here today among such a dedicated group of people. I want to express my gratitude to Grace Hill Bible University and the Victorious Living Foundation led by Dr. Nicole Francis Cotton. Dr. Francis Cotton is someone I deeply respect, not only for her hard work as a certified holistic health coach, but also for her unwavering commitment to improving lives. Guess what? VSR too is in the profession of improving lives. For this reason, we did not hesitate to collaborate with Victorious Living Foundation on this important initiative, in particular for this sensitive topic of suicide, that will be addressed from different perspectives. Suicide is a silent crisis that impacts individuals, families, entire communities. Suicide is on the rise in our community, with the most recent victim only 14 years old. As Minister of Public Health, Social Development and Labor, it is my responsibility to help break that stigma. We must understand what brings someone to such despair and work together to providing hope and support. By raising awareness and having open conversations, we can save lives. With regard to the participants in this masterclass, based on conversations and their professional backgrounds, I can state with confidence the knowledge and commitment in this room have the power to change lives and strengthen our community. Your efforts are building a future where no one has to face their struggles alone. Let us remember that suicide prevention is a shared responsibility. It is something we all can contribute to as family members, friends, and community members. Together, with God's guidance, we can create a network of love, support, and understanding. Thank you, and may God bless you all.
Hi, my name is Barbara Cox, and today my presentation is on Understanding and Preventing Youth Suicide, a focus on children and adolescents. So we will look at introduction, the epidemiology, contributing factors, suicide risk assessment, special populations, contemporary factors, methods of suicide, suicide prevention, and then we will conclude. Since 2010, suicide has been the second leading cause of death in the U.S. for youth ages 10 to 17. Suicide is the 11th leading cause of death in children ages 5 to 11. Here we will look at our suicide rates here in St. Martin. In 2020, there was 1. In 2021, there were 2, but 1 teen. In 2022, 2. In 2023, we had 2, 1 teen. 2024, we had 3 and 2 teenagers. So we also conducted a survey at the St. Martin Academy, VBC, predominantly with youths, 122. So the first question was, have you recently felt hopeless as though things will never improve? We had 27%. Have you ever attempted suicide in the past? We had no, 75.4%, which is good. Have you experienced any of the following symptoms? We had 73.8 difficulty sleeping. We had 59 fatigue or lack of energy. The other question, if you were feeling overwhelmed or experiencing thoughts of self-harm, how likely are you to seek help from a mental health professional or support service? 33% said not really, and 29% maybe. Contributing factors, genetics. Family history can increase the risk of suicidal thoughts in youth. Studies show a link between family members' suicide and similar thoughts in surviving youth. Serotonin linked to suicide in adults is influenced by genetics but hasn't been studied in children and teens. Mental disorders. 30% of U.S. youth contemplate or attempt suicide. A study found that youth who attempt suicide by ingestion are more likely to have mental disorders. High-risk groups include those with psychosis, mood disorders, anxiety, substance use, impulse control disorders, and eating disorders. Social determinants. Family instability, such as caregivers' illness, unemployment, abandonment, incarceration, or death, increases youth suicide risk. Chronic exposure to violence, abuse, loss, self-destructive behavior, or homelessness can lead to mental disorders and suicide risk. Academic and behavior problems in school also contribute to increased suicide risk. Sleep. Sleep deprivation impacts youth judgment, emotions, behavior, and suicide risk. A survey of 67,615 U.S. high school students found that 17.6 got less than 6 hours of sleep on school nights. These students were 3 times more likely to feel sad and 4 times more likely to attempt suicide compared to those who slept 8 hours. Risk assessment. The suicide risk assessment is essentially in evaluating a child or teen's risk of suicide and implementing appropriate steps to mitigate risk. Psychiatrists should elicit information about the youth's past and history of suicidal behavior. Details about the antecedents, triggers, intent, severity, and outcomes of past self-harm events are important. The assessment should include the rationale for and intensity of thoughts about dying, recent behaviors, and the existence of a plan, intent, implementation capacity, and anticipated consequences. Data obtained in the risk assessment should guide the crafting of a crisis intervention plan. Clinicians should be cognizant of unique risk factors that may not be included on a standardized checklist. Neurodevelopmental factors, cultural identity, and psychosocial stressors should also be considered when evaluating a youth's risk for suicide. An assessment of the youth's past mental health history, as well as an inventory or screening for existing symptoms of mental disorder, are important parts of the risk determination. Youth and their caregivers should be interviewed separately. An evaluation of how the youth child functions in various systems, home, school, work, athletics, religion, extended family, and health. Evaluators should determine whether the suicide behavior may be aggravated or mitigated by involvement with certain individuals in certain settings or one or more activities. The clinician should inquire as to what will compel the youth to engage in suicidal behaviors and explore the likelihood of the triggers occurring and ways to mitigate this. Safety is key. So if the teen or child has access to firearms, other weapons, medication, and other items that can inflict self-harm, these should be explored. Healthcare professionals, parents, and if possible, youth should collaborate to examine safety measures. Special population. Children. Rates of suicide among children ages 5 to 12 years have been increasing. Sexual and gender minority youth are at higher risk for emotional and physical victimization, sexual assault, and homelessness. Autism spectrum disorder. Among youth who have both ASD and depression, 14% have experienced suicidal behaviors. Chronic health conditions. A Danish study determined youth were at risk for suicide behavior after they receive medical care in a hospital, especially youth who have many hospital visits for unstable chronic medical conditions such as epilepsy and asthma. Contemporary factors: bullying and electronic media. Bullying is a behavior that is experienced by 10 to 20% of youth. Those who have mental disorders, physical deformities, or otherwise non-conforming are at higher risk for being targeted. Electronic or cyberbullying has become more common because the internet facilitates the rapid dissemination of negative commentary without confrontation. Victims of bullying are at increased risk for engaging in suicide behaviors. Researchers found that youth in middle and high school who spend more time on electronic media platforms were more likely to have higher levels of emotional health concern and suicidal behavior. Methods: 5 to 19 years of age U.S. youth. First, suffocation, hanging, 46%. Firearms, 41%. Poison, 6%. Falls, jumping, 2%. Transportation, 1%. Suicide prevention. Protective factors. Mental health care. Youth who get and follow mental health care lower their chances of attempting or dying by suicide. Supportive parents. Having parents or caretakers who care about their emotional well-being helps protect youth from suicide. Coping skills. Good coping skills like waiting for rewards, working well with others, planning for the future, being self-directed, and making changes in life can reduce suicidal behavior in youth. Means restrictions. Limiting access to methods of suicide is an effective way to reduce suicide deaths. Guns should be unloaded and ammunition stored separately in locked boxes or safes. Youth should not know where they are stored. Treatment. Hospitalization. Youth with suicide behavior should be hospitalized if risk can't be managed in a less restrictive setting. Effective therapies: dialectical behavior therapy, cognitive behavioral therapy, and mentalization-based therapy are the most helpful for youth with suicidal or self-harming behaviors. Medication. For severe symptoms, medication can help and improve how well some youths respond to therapy. Suicide prevention in schools and community-based agencies. Community training programs. Suicide prevention programs can reduce suicidal behavior in children and teens by helping identify and refer at-risk youth to mental health care. Reducing stigma. These programs also help reduce the stigma around mental health by showing that mental disorders are real, like physical ones, and that early help can prevent long-term problems. Conclusion. Suicide in children and adolescents is a serious issue that can be reduced by improving access to treatment and limiting access to lethal means. Suicide prevention tools, training, and education should reflect the changing needs of youth, including the medical, social, and cultural backgrounds. Suicidal programs should address the unique needs of different groups of children and include education on how electronic media can impact suicide behavior.
Thank you for taking the time to watch the previous enlightening presentation from Grace Hill Bible University, St. Martin Campus's Suicide Assessment and Prevention Masterclass, themed Igniting Hope in Our Community, Preventing Suicide. We are extremely grateful to the Honorable Minister of Public Health, Social Development and Labor, Mr. Rishanel Brooke, and his cabinet for agreeing to collaborate with us. This masterclass was presented by the students of the Master's Counseling Degree Program of Grace Hill Bible University, St. Martin Campus, both as a public service and as part of their grade for the course, Introduction to Suicide Prevention, Assessment, and Treatment. I am Dr. Ernest Francis Cotton, the chair and developer of Grace Hill Bible University's counseling degree program for the St. Martin campus, in collaboration with Victorious Living Foundation, of which I am the visionary. Victorious Living provides personal and professional development tools to transform families, relationships, youth, individuals, and organizations through coaching, training, counseling, retreats, workshops, and conferences. Let me briefly share about Grace Hill Bible University so you understand the mission and vision of the university. Grace Hill Bible University equips men and women for Christian living and Christian service worldwide. Its vision is to bring glory to God and hope to the world by preparing students for Christian service. GHBU is accredited by Global Accreditation Association for Biblical Institutions, which is authorized by the state of New Jersey. The degrees and programs offered either meet or exceed the New Jersey status. The university was founded by its president, Dr. Aldanza Ambrose. The dean of the St. Martin campus is Dr. Orlando Wilson. So who am I? And why do I qualify to be able to develop and teach a master's level counseling degree program? Well, I co-developed the grief counseling course for the Bachelor of Science in Social Work for the University of the West Indies. I graduated with honors from the University of Tampa in 1995 with a BA in psychology. I earned a master's in counseling with emphasis in marriage and family therapy from the Oral Roberts University in 2000. I was awarded an honorary Doctor of Divinity by Grace Hill Bible University in 2006. I'm a certified success coach with the International Coaching Federation, a certified lifestyle prescription health coach, and emotional freedom techniques practitioner. I also obtained specialized certification in trauma therapy and have been successfully providing therapy and coaching locally and internationally for the past 25 years. In short, I am a master therapist who helps my clients to transform their lives. Several years ago, I was asked by the dean of Grace Hill Bible University to teach a biblical psychology class. And while preparing to teach that class, I did some soul searching and admitted to myself, too many people in our societies are emotionally, psychologically, relationally, and spiritually challenged. As a result, our families and communities are experiencing dysfunctional and unhealthy relationships. I determined that if I am truly to help our students make an impact on our island and the world, they must be equipped to meet people where they hurt most and have the necessary skill set and mindset to transform their lives. Consequently, I set out to design and develop Grace Hill Bible University St. Martin campus's counseling degree program. I'm delighted to share that we've had several pioneers who graduated from the program and are making a difference on St. Martin and in the world. Our classes are offered online through our virtual classroom. Therefore, anyone from around the world is able to access our courses. We provide the curious learner who has a passion to counsel the fundamentals of counseling to be able to address the growing needs and challenges in our societies. Courses include Christian counseling from an African indigenous perspective, utilizing energy psychology in counseling, effective counseling techniques for transforming the lives of children, young people, and families, which is being offered this semester. The fundamentals of marriage counseling, counseling ethics, suicide assessment, prevention, and treatment, spouse abuse, a treatment program for couples, effective grief counseling, counseling practicum, counseling internship, and more. Last semester, our deep dive focus was suicide assessment, treatment, and prevention. Our island has experienced the tragic loss of precious souls over the past several months due to suicide, which has sent shock waves in our community. Our hearts go out to the families who have been directly affected by these deaths. It is therefore absolutely imperative that as a nation, we are aware of the signs that someone is contemplating suicide, and that we have the necessary tools to support and encourage them to find better solutions to their challenges. Therefore, this course serves such a need. Together, and I mean together, we can transform the health of our nation through education, and we can prevent suicide by igniting hope in the hopeless. Thank you for your attention, and together let's take care of ourselves and each other and transform our nation.